Dorchick, and I'm with Buffalo County Community Partners.
I'm Matt Morsell, also with Buffalo County Community Partners. And I'm Eduardo, the Community Response Assistant here at Buffalo County Community Partners.
I'm Bill Stevens. I'm with Chariots for Hope of Central Nebraska.
My name is Jeremy Gall. I work as a nurse case manager at Children's Physician. And I'm also working with a research project through, it's called RADX, that works with Michael. Yes.
And I'm Marta Marfileño with Buffalo County Community Partners.
I'm Jana Miller, also with Community Partners.
And we'll go up to the top of the screen, and I see Haley, then Sarah, and then Penny.
Hi, I'm Haley with Two Rivers Public Health Department.
Hi everyone, Sarah with CHA Health.
Okay, then we'll go to Abby, Emily, and Jamie.
Hi everybody, Abby Olson, Director of Care Management, Social Work at CHI Good Samaritan, and Richard Young.
Hi everybody, Emily Lehman with Unite Us.
Jamie Legates, Assistant Director at Families Care and co-chair with my friend over there.
Hey guys, sorry I missed my slot. My name's Penny Parker. I'm with Nebraska Total Care. We're one of the Medicaid plans, and my dog is over here being crazy, so I apologize. So I'll keep my computer muted.
And sorry, Michelle Tucon, Buffalo County Community Partners.
Okay. And so for those of you that are just on here for our transportation portion of the meeting, we're going to start off with that. And Denise is going to help us with that. She just walked away though, but to get us rolling, where we wanted to start, well, we wanted to thank you all obviously for being here and continuing the discussion that we had last time. We started this conversation. I mean, it's been bubbling up for a while, but we brought people together at the last community response meeting in January, and we brought up a few pieces that we wanted to bring you guys together again and add more partners. But at that meeting, we really worked on identifying what's in the community for resources related to transportation. And so Matt will pull it up there, but if those of you in the room, that's what this document is our resource guide, directory. I don't know what the right term is. Form, we'll just call it a form right now, that we worked on last month the last time we met in January. So we just wanted to start out by asking if you've had a chance to look at it, if there's anything missing, who else might need to see this, how you're using it, just basically just to follow up and see what you guys think of our list and how we can move forward with this. So I'll pause for a moment and kick it over to Denise as soon as she's ready. But if anyone has anything to share related to this guide.
This is Abby. I did look at it a while ago. So I apologize if this is on there now, but there is a new taxi cab company in town. I'm not sure. It sounds like they may be active. But I just lost the name. I think it's like Catch a Ride or something like that.
It is. I reached out to them and invited them to this meeting. They were hopeful that someone might be able to join us, but we haven't seen them yet. So
yes, John Cervantes, it looks like. So
yes.
You know, I see the 2 Medicaid providers on there, but there should be a third one.
There is. We're missing one, and that's because that person wasn't here.
And I do have.
Is that Healthy Blue? Is that who we're missing?
Yes.
Yeah. Do you want to clean a copy with this?
No, and then
yeah. My husband's actually on the Healthy Blue one, but I don't see any look for transportation. There's a lot of benefits. eligible members can receive transportation benefits such as a gas card, Uber gift card, or bus pass.
I think it's on page 2.
Non-medical transportation to WIC appointments and educational classes like child care, breastfeeding.
Why don't you look, did I have it flipped over at the very bottom?
Oh, here, they go through MODIV care, MODIV care. And their phone number is 1-844-531-3783. And I'm not familiar, that looks like the same as what United Healthcare uses as MODIV care. So they do have some benefits for transportation. So we'll add, I'll hand that to Eddie. Do we have this or? Okay. We'll give that to Eddie and he can add that on to this list. And then I think we've got the Kearney taxi cab.
They're on our email list, yeah, I have their contact.
Anything else glaringly absent or incorrect?
Denise, you can probably change what's next to my name for Abby to be the contact for all of that, just so nobody's reaching out to me. Perfect.
Oh, okay, on the email instead of Sarah Sandslot to Abby Olson.
You know, I did go ahead and send a list of transportation resources that was compiled for children. So most of it's like Eastern Nebraska area agency. But the one that kind of caught my eye when you're looking at community is the VA has.
Okay.
So I'll give you that.
Is that the only thing you saw maybe missing?
Oh, well, no, there's tons. I just wasn't sure what was familiar. So I'm still trying to make sense of who everybody has for contracted providers through the Medicaid ones.
Well, if we have a minute, why don't we see if we can get some talkings made of this today, and then everybody can leave with this, and then we can also attach it to the minutes so those of you on Zoom can get a copy. It's about 4 pages of community transportation resources developed by the Eastern Nebraska Office on Aging. Awesome. Thank you. Okay, we'll make copies of that as well. And we have someone new to the table. Would you like to introduce yourself?
I'm John Cervantes. I just started the new taxi business here in town. Sorry I'm late.
No worries.
Because y'all think calls. Yes.
Well, you are at the Buffalo County Community Partners office. We bring people together to talk about issues in the community and how we can all work together to solve issues. And transportation is always an issue in our community, but about, I don't know, 3 or 4 months ago, we decided instead of talking about what we don't have in our community, why don't we talk about what we do have in our community? So we've started creating this. We know you're missing from here, but we're going to get your name and information added on here as well.
Okay.
And so I think we wanted also some time for you just to talk a little bit about the services that you are providing in the community. Okay. And most of the people around the table are agency folks or other transportation partners, staff from our office, and then we do have a few people, the managed care organizations, hospitals, on the Zoom call as well.
Okay.
So if you want to tell us a little bit about your company and what your services are, we would be very appreciative.
Perfect. Okay, so we obviously provide public transportation. We are a metered service. We're not flat rate like a lot of the other companies around here. We're trying to fill the void that Kearney Cab left. And we found out in the last week or so that it was a huge void. You know, a lot of people, they don't want to use the right because they have to set an appointment. They call us trying to set an appointment, which I mean, we can't do just for some fact that there's company to serve. We can't stop our service to make, you know, special appointments for people. Yeah, you know, and we've had a couple people upset. They want to get to their doctor's appointments on time, which I understand, and we try to accommodate that as much as possible. We thought 3 vehicles was going to be enough. Sorely wrong on that one. We thought 5 drivers was gonna be enough. We missed that one too. But we're not DHHS designated. We don't have handicap accessible vehicles, which I know a lot of people that have called us, they wanted that. I just try to explain to them, we're not into that right now. And a lot of it has to do with being a startup. There's a lot of cost to that. As far as insurance liability, it's just not feasible right now. Vehicles, there's a lot more entailed with it, and I'm sure a lot of you know that. But right now we are trying to fill that void for Crossroads, Dismiss. You know, we've had meetings with a lot of them as well. We're trying to get UNK. We've done a lot of transportation for the foreign exchange students that can't drive and don't have that resource. We have picked up a lot of doctor's appointments in the last week or so, which, I mean, we're not real well equipped to do it just because of some of the circumstances that the patients are in, as far as wheelchairs and how, you know, it's kind of tough, but we're making it. So.
And what does that look like for families and our students?
So right now, I've actually transported a few babies. So we can transport them. There's seatbelts for, you know, car seats, other passengers, obviously. We have right now in our vehicles, we have a GMC Acadia, which we can fit 6 in. We have a Cadillac that it's a little crossover. We can fit 4 passengers plus the driver, and then we also have a sedan which we can fit 4 passengers and the driver. We kind of wanted to stay below that 7 passenger threshold just because, like I said before, the insurance liability, it goes from one level to another extreme once you get past a certain level. But yeah, I mean, we're equipped to move families around, and we haven't had a whole lot of it, but we can do it.
Now, are you familiar with Sleep Kids? And they're having a class coming up in April.
Okay.
For installation of car seats.
No, I wasn't.
I don't know if that's something you'd be interested in.
It would. I mean, so most of the time the parents do it, but I mean, if they need help doing it, you know, I ain't got it.
Do most of the parents have car seats, or is that something that you would need?
I think, you know, the ones that we picked up, they had car seats. I know that there was one family, and I don't know that maybe it was just a little bit for that car seat.
And maybe just even the Safe Kids cards that you could give to.
Yeah, absolutely.
Car seats, yeah.
Because I'm sure Tracy has the latest and greatest for the ages and the heights.
Yeah, I mean, her feet were hanging over, and she was kind of big for it.
Do you have her contact info that you could kick out or hand out?
I just wondering why.
Yeah. Okay. Yeah. But I wasn't sure if you had it all the time. Yeah.
865-2011, and she's really good about returning calls.
And what was her name?
Tracy Detlon. DOTLON. She's an RN that works part-time through CHI.
And those services are free. I mean, just she does provide, and I think can provide the car seats
at a lower donation.
Okay.
And I think last time I talked to her, she said, you know, they're going to have a car seat training again in April. So she would be the contact person, I think, for that. And then what else did she say? And then she was hoping that maybe by May they could actually get back to having events in the community. Like these two.
I think Emily plugged her phone number up here in chat. You can see that there. 308-865-7697.
It must be different.
That's a different number.
Yeah.
I was just gonna bring up, Tracy is on the platform and can accept Unitas referral. So if you transport somebody that doesn't have a car seat, you could send them over to her and she can connect them with the car seat too.
Was that the same?
Yep. It's
Okay.
Yep, it's the same person.
Yeah. The phone numbers just changed, I think.
They have them kind of throughout the state, different areas, but
She just has her Good Sam number now.
I have 865-2011. She has all over her door here.
But 865 would be an office, right?
She has voicemail and she's good about it.
Yeah, everything she has over here says to call that number.
Yeah, this is Abby. I was just gonna say that. I think it's best to tell people to call beforehand. She wears a lot of hats and she also works as a nurse on the floor sometimes, so. That way they're not disappointed if they show up and can't meet with her right away.
I did put her email address in there, I guess, for providers if you wanted to reach out and find out more about her services.
Other questions for John?
You know, the one thing I was wondering about this, do you have a column for like when they're available? Like Monday through Fridays?
I think it was kind of under what groups do you serve,
Okay.
so I don't know if we had very specific times available. Are you available 24/7?
24/7.
Okay.
This is Abby. I do have a question. Hi, John. I know that you and I need to connect. I'm at Good Samaritan Hospital, so thank you for dropping off your information. If you talked about this, I'm sorry, but what kind of service area are you able to cover? Are you able to go to like Elm Creek and the surrounding towns, or how
Yes.
far do you usually go?
So I can go, as of now, I can go Kearney County, Buffalo County, and Phelps County.
Okay.
But we're trying to switch that over to do statewide just because we've had a lot of calls that need transportation throughout the state, so.
Okay, oh, that's great. Thank you.
You're welcome.
What are your more busy times of day or days of the week?
So, you know, I used to work for the former cat company, and I was trying to base the busy periods off of that. I'm not sure what's changed, but it's all changed. Mondays used to be really busy with doctor's appointments. They're not as busy. I've noticed they come in spurts. They're not as sporadic as they used to be. It's more early afternoon, later evening. So, I mean, we've been pretty free in the mornings other than people trying to get to work. And then after you get people to work, then it seems like it's more doctor's appointments. And then later on in the evening, it's bars and restaurants and stuff like that. So, I mean, based on the 12 days that we've actually been in business, honestly, and I know it has a lot to do with, you know, starting up everything. We've been busy every day. So, I mean, it's kind of hard to tell right now what days are going to do what. So,
If would you be able to work with us if we were able to find funding to purchase vouchers for people to have drives? What would that look like, and would that be something you'd be interested in talking more about?
absolutely. I've been in contact with CHI about it as well. I got them paperwork, all the credentials from the business going out. But yeah, that's something that we're open to. We're already working with a company that works with KRMC. So it's an option. We're definitely open to it.
I think one of the funding pieces we have would be majority of getting people to work. If there's an option of like getting people to work by 8 in the morning on a routine time, that's something that you work with. So, okay.
We have quite a few people that need rides to evenings. So I mean, it's been a pretty constant thing with getting people to work, even at home for work. But yeah, we're open to that, absolutely.
I think most of our work questions. Was there any other things we could do with people for rights?
That was the only thing I was thinking of our last conversation also was school. I don't know. That's
you know, I have worked with a situation where there's a family that has a child eligible for Head Start, but they're not able to get somebody again. It's a transportation. So there, I don't know. I would appear if you would travel with that child or not.
Or
they probably could. I mean, she's 4. I 4. You know, because when I was looking at this list, I thought, oh, maybe church volunteers would be interested in helping with a situation like that. And then my other question, and Penny, maybe you can help me on this, but I have been wondering about the Medicaid plans. Do you think when it says that they might be eligible for like gas vouchers or anything like that, would that be something that they'd ever consider working with Ride or the cab company where you could say, here's my $20 gas card, I can get a punch card for 10. I don't know how that works, but you know, Medicaid does actually offer a couple options for transportation to get to and from WIC appointments, Medicaid, you know, appointments here all the way to, you know, Omaha and back. But you know, some people, I don't know, I just see that they have those gas vouchers available, and it'd be nice if somehow they could turn, you know, be eligible for that, but turn it in and turn it into a ticket that they can use locally.
That's a great question, Jara. To be honest, I'm not sure. That's really the best answer I can probably give. I know Healthy Blue does have some gas vouchers, and it's up to each plan. You know, each year we kind of go through and look at where our gaps are and where we can impact health outcomes and what kind of incentives we can offer in order to, you know, make a difference in those things. And we can't address everything. So if we're offering $15 for colorectal cancer screenings, that might mean something like gas vouchers isn't an option for us. So we definitely have a team of people that are reviewing those kind of things. Hearing from you guys though does help, and that definitely gets funneled up the chain. So I can definitely pass information along to let folks know that that's something that our communities are wanting or interested in. That's probably the best option that I have at this point. Other things might be like sponsorships. So if there was a program that we could sponsor, that might be easier than us managing a voucher program. So there might be a different angle that we could look at for some things. Definitely, you know, like I said, open to having those conversations. And it would be, I don't know if Jordan or Gloria are on the call today, but they might have another perspective too from their plans point of view.
Thank you, Penny. I know we want to also hear from Emily too on some examples of how they're doing referrals in Kansas and also out in the Panhandle. So any other questions maybe for John before we move on to the next part of transportation conversations? And you might want to give just a little bit commercial, maybe Emily, about Unitas, because Unite Us is Chariots of Hope and the taxis. Probably this is maybe the first time they're hearing about Unite Us.
Yeah, thanks, Anise. I've done a deep dive of both organizations. I'm super excited to have these conversations. And after hearing all of these like transportation ideas and possible funding streams out there, that makes me even more excited. So John, nice to meet you, and Chariots for Hope. Nice to see you guys here. So First Unite Us is a longitudinal data software, cross-sector collaboration. Different organizations can send and receive referrals with shared partners on these shared clients. So just for context, everybody already knows this for the most part, but my background is in child protective services. And so we had a lot of transportation needs when I was in that field. And we had like 2 or 3 different organizations that we contracted with for the most part, but there were still issues with transportation, to court hearings, to visits, to family support, whatever it was. So what we've done in Western Nebraska is I have 2 organizations on there. A third will be coming on. And we're getting ready to hopefully switch over some website design for one of them. But it's Kimball County Transportation Services. Christy Warner is the contact over there. So we've created a assistance request button for them to embed in their website. So I don't know if I have screen sharing capability, but I can show you what their website looks like and the potential for this. So hopefully everybody can see this, but this is their website right now. And so we would potentially be replacing this book a ride button. So any organization that has a refer here, book a ride, we can replace that with a button that they will fill out with their information, or we can specialize it. So this is what the information would look like: first name, last name, date of birth, contact information, preferred language, what service are they seeking? So it'd be transportation or whatever service. They would write in this box what their need is. So if they need a ride on 326 at 1 p.m. from Kearney to Omaha Children's, they would put that information in here. They would consent to send and receive referrals. They would submit it, and this referral comes directly into that organization. So this would go right into Kimball County Transportation. And then they would serve that client through this referral. They would still reach out, confirm transportation information, but they're reaching out anyway because they take all of their rides, either booking a ride or through phone. So this is a different way to track that, where it's all of their information is already coming in and they have to call the person to confirm transportation anyways. They're already making a call. So these are no extra steps. They're not creating a case. They don't have any extra work. So that's an opportunity to just generate referrals from the community directly. You can also receive referrals directly from another provider, or you can send somebody. So John, for instance, if you wanted to refer somebody over to Tracy for a car seat, you could electronically refer her or someone over there for a car seat too. And then we track all of this data, right? So we know how many people you serve. And if you need that for funding reasons or to support another vehicle, we can tell you how much foot traffic you have had with your transportation agency. We can track what demographic you're serving. If we choose to maybe track some of this or have funding streams. So if we went the voucher route and CHI had vouchers or Penny had vouchers, Haley has, I think, some transportation dollars still if Buffalo County wanted to do vouchers. In the notes section, when you do a transport, you can document that this was like a CHI voucher or a, Two Rivers voucher, whatever it is. And then you can pull reports on how many of those clients received this particular voucher to track those dollars each month too. So Haley could refer somebody over for transportation needs. You get that referral and you know it's going to be paid by Haley's transportation dollars with her program. In Kansas City, we work to onboard a church. And so they had volunteer drivers that they wanted to be able to pay a stipend to. So we use the platform in 2 different ways to get volunteers to come in because different agencies have volunteer opportunities, and then they had funds to pay a stipend. So they used it to get volunteers, and then they used it for people to self-refer for transportation. So everything goes out of Garden City, and then it goes to Hutchinson, to Kansas City, to whatever direction. And they had drivers associated with each leg of transportation. And then they actually have a scheduling app with the drivers that they do internally. That's not part of the platform. But then they're able to plug these different rides for the clients into different programs. And then they track all of the mileage for the programs, dollars spent for the programs. And then, you know, when somebody's assigned this Hutchinson route, this is the driver associated with it. So for the community, that was good because they were familiar with who the driver was going to be as well, which that may not be an issue. Garden City is pretty small too. So just some different ideas around this, ways to document things, ways to track information. It's free to join the platform for transportation organizations. I also had a pretty big conversation with Intellaride a couple weeks ago out of Omaha. Unfortunately, they've lost the Nebraska NET contract, but they have a heavy presence in Colorado. So I've referred them over to Colorado too. So if we were to get different transportation organizations on in our area, the two that are on in Scottsbluff Chapel can refer back and forth. So if one organization couldn't meet the need of a particular client, they can forward that referral to the next organization. And so when that third organization comes on, she's actually out of Alliance. So she can get in that kind of referral circle if a need can't be met. And that there's potential of that happening with this big team of transportation providers in this document too. So on my end, I can reach out to everybody and see if they want to onboard, and then referrals can be exchanged. They can send, they can receive. There's no requirement for how many referrals you send or receive. It's however you want to use the platform. We do all the training. So if that's of any interest to anybody that provides transportation, I'd be happy to chat. Denise, did I miss anything? What else would you like me to include? That was a lot of information for anybody who is new to Unitas.
Thank you, Emily.
Sure.
Yeah, I'm just gonna maybe pause there and just see if people have questions for Emily. I don't know that we have any of our churches here today. We had maybe 3 or 4 people last time that were all here from the churches. So that, I think if that's an area we want to continue to explore, we need to be more aggressive maybe in getting them to the table to talk about that.
Okay. There
were at least 2 churches that we knew of that were interested in doing some volunteer transportation.
Okay.
And I think both of them were board members. Kathy Gifford was one, and then Dr. Schaefer was the other one. That both of their churches were kind of asking how they could help. And they both were too busy today to be, I'm not too busy. They had other commitments. Sorry, that sounded bad. There's very significant commitments today that they were unable to join us. I'm always in awe of what you do pull together, Emily. I think that helped us visualize a little bit.
Yeah, if anybody wanted to see like how that would look on the platform to document like dollars spent or anything, I can certainly do that because it is good to track funding for different programs too, which that is all free as well. So it's all included in your access to the platform.
So the Kimball County Transportation Services, are they similar to RIDE, or would they not be comparable to anything in Buffalo County?
They would, but they serve Colorado and Wyoming as well. And they have some new services that they're going to be onboarding in 2023. So they have like Scottsbluff to DIA. They have Kimball to Scottsbluff, Kimball to Chapel, Cheyenne to Kimball. So what they don't do is like a Denver to Denver. So if somebody needed transport from Chapel to Children's in Denver, but then just wanted to go from Children's in Denver to like a family member's house in Denver, they don't do Denver to Denver. transportation. They don't do like Wyoming to Wyoming. It would need to be somewhere like on the trip back that they would drop someone off. So even if they started in Chapel and we're going to be going to Denver and then coming back to Sterling, that would qualify for their services. But everything is managed out of Chapel for Kimball County Transport. And then the second organization is Tri-County Road Runner, and they're out of Gering, Scotts Bluff, and they just do local transportation only. And then they have about 6 different like routes and levels of transportation that you can request. They do not have a like push button to book a ride through us though, but any organization can have that to funnel referrals directly into them. So if they don't derive from a provider, again, we can get just internal referrals from the community. So we can set that up for anybody who's already on the platform.
Thank you.
Sure.
I'm just thinking about even coordination for you guys too. If you knew that that transportation existed from that end of the state on in Denver, it would be helpful as well, I would think.
Yeah, we've.
It's interesting that between John and Emily here, some of the programs that we're looking at rolling out kind of tie into the church volunteers. It's like an Uber type say thing, only it's nonprofit, so there's no charge. So not to take business from you, no, but there's people that need that. And then the other thing that we're looking at, and it's probably longer because it's more money, is emergency grant vouchers, where they could use they could use whatever, depending on how it's set up. But again, that's down the road. Next week I'll be looking at the free Uber system. I'm not sure what we're going to call it yet, but I think that would work well with the church volunteers. And what I see, even though I don't know exactly, they're doing this in Omaha, and they've got a lot of volunteers and it works great. Is that Chariots would be like a schedule coordinator, and the volunteers could plug in from various churches or whoever wanted to.
So on this, on the very first page, towards the bottom, that you named Kathy Gifford and Ken Schaefer. But if you wanted to follow up with either one of them, I know both their congregations are very, very interested. And then I think on the next page, Justine with Carnegie Free Church would probably be the other one.
Okay.
If that's something that Chariots of Hope is thinking about. We're so excited to have both you gentlemen and your businesses in this community. It's just, as I'm sure you're both finding out, and you probably already knew that this was desperately needed in our community.
Yes. Yeah.
We did want to give you some time too, from Chariot's perspective. How can we help you? What are you needing from the community? Other things that are on your mind?
What I've been struggling with, I've been working on getting this established, is I was just counting up the number of people that, when I presented them with the idea and asked if they would serve on the board, immediately said yes. And then they got into it. You know what? This is more of a commitment than I can do. And then there was at least 5. And one, I understood, took a job out of town. And she was a real go-getter, and I was really hoping to use her skills. But again, I want to involve as many churches, since we are faith-based, but I want it to be a community-wide thing. So if I can contact these people and see if they can recruit people to be board members, because it takes a certain amount of leadership and delegation of who's doing this and who's doing that, and we're all volunteers. So we're, still have jobs and trying to get this going too. So it's, that won't be true for me forever, because I'm getting close to retirement, but I'm not there yet.
You know, the other group we tap, it's a young group, but Leadership Kearney.
Oh, yeah.
With their graduates, and they'll be graduating another class, which you don't have to wait for graduation, but they're a fantastic group to get started on boards. They have that energy, I think,
Yes.
probably that hands-on
That's a good idea.
of what you're looking for. Just know that this may be the first board they've ever served on. So that board development piece would be important for some of them, but they're very eager, their hands, feet on the ground.
Yeah, well, younger
Great
people
board.
would be awesome.
Great board members.
Okay.
Any other suggestions for board members? Anybody here?
Sonia.
What about the group of the health ministry, like reaching out to Kathy Gosh's?
Yeah. Is Kathy on here?
I don't think she is. I know Kathy.
You know Kathy?
Yeah.
She has a group, Buffalo County Health Ministry Network. And so that was a group, or is a group of health ministers or parish nurses.
Okay.
So that would get you out in front of many parishes. We do
Great.
have an email list that we used and a mailing list of all the churches going through the pandemic. We haven't updated it since then. And before that, we used it for all the floods. But we do have a pretty sizable list of faith communities throughout Buffalo County that we can get information to fairly quickly as well.
I was just thinking, because I've been working with trying to, some of the families that I work with, I noticed that they don't realize that there's actual meal opportunities like Jubilee meals. Family of Christ has a meal, the first and third Wednesday.
It should be on my list. We've been really pushing the
Okay.
late piece.
Well,
It should be on there.
Okay, so Jubilee is on there. They need to change their times, I think, and I mentioned that to Sherry, I think it says 5 to 7. And I think they only start 5:30 to 6:30, which is actually the same time as Family of Christ. And I did talk to Cheryl with Pastor Carl yesterday, a Family of Christ. And I gave her
contact person for my link.
Yes.
And I mean,
Her name is Anna.
And you're sending those things to her as well. Ask her, okay. Yeah, because that person at UNK will update that with what you're finding.
She's the one that's taken it temporarily on because they still don't have enough. I think they were able to get it for like 6 months.
Okay. Yeah, we were just wondering that the other day.
And then
somebody.
this is the new gal that's.
Yeah, just send her those updates and she can make those updates very quickly. Should be able to.
So that's just an app then?
Yeah. Yeah, you want to be on that app, both of you as well. My Lake 211, family, Nebraska Family Helpline.
Yeah, getting 211.
What was the main one?
Since you can my page on Facebook, I mean, I've got a pretty good following, and I figure if I can get, you know, whatever information I can for, you know, different groups and stuff, to get the word out there. You know, a lot of my business was based on word of mouth. It went from nothing to something I didn't expect very quickly, just, you know, and it was word of mouth.
Last time we met, we had heard a rumor. So we're like, let's watch. So then pretty soon we found something on Facebook and then your article come out, we're like, there they are.
Yeah, it was a long process, but here we are, so.
Yeah, 211 is a statewide system. It's just like 911, only it's information system. So you can go online on the website, or you can call 211 and ask for text, right? I think you can text. I think maybe that is it. And then you can say transportation and your referral will be the first ones that pop up. But you'll have to contact 211 to make sure you're on the system for those referrals. MyLink works the same way. MyLink actually lives on your cell phone. And it doesn't have to be downloaded all the time. And it's in multiple languages. 211 is not quite yet multiple languages, English only, but MyLink is 6 languages. Yeah. And it's really nice. We talk about it with individuals maybe in abuse and neglect because there's no trail. absolutely no trail for any of those resources that you're calling you're securing.
Okay, perfect.
And I've had really good luck when you've got it on your phone in English, and you've got maybe passengers that are Spanish. You can contact that.
And I'll just give a plug for 211 as well. They're actually our coordination center for Unite Us. So it's possible for you to receive referrals from 211 as well through the Unite Us platform. So if somebody called from the community and had a transportation need, like called 211 directly, they could electronically refer them to you. I've already stolen your email address, John. I plan on sending you all of the things.
Hey, that's fine. More the barrier.
All right, I think the last question, what can Buffalo County Community Partners staff do for all of you in regards to transportation? We want to take a little time, work through these pieces. I think this is maybe our second or third meeting focusing on transportation. We just wanted to ask what you wanted to do next.
Sherry from Jubilee Center doesn't happen to be on today, does she? She's okay. Well, I had visited with her in the last couple of weeks, and one of my visions was kind of one of her visions. And I was able to contact somebody through City of Kearney that does maps. And that's what their job is. And I just asked if they had a map of Kearney, and that maybe some of these places could be put on. You know, my first thought was just Jubilee meals or the hot meals that are offered, where they're at for this 3 months, where they're at for this 3 months, what times they are, that type of thing. You know, because she had just mentioned that I've always wanted just a tear-off sheet that I could give to somebody, you know, when they stop by and they're looking where the Crossroads homeless shelter is, you know, to walk there. So I'm hoping maybe in the next week or two to get maybe a little bit of a draft, but I am not the technical person to do it with that. But I did kind of think, how cool would that be if it was on like maybe City of Kearney website, or, you know, several options where maybe you could just put down food pantries.
And that the Department of Labor, because they come up to where I'm at Boat Rehab, and we're clear by the bars, and we're like, oh, unemployment, you need to go to the Department of Labor. That's clear on the other side.
Yes.
And it's so confusing for people.
It is. And then even pharmacies, because what I realized, I came up on a situation that I've not even thought about, but you know, a lot of families, at least migrant families, they go to Walmart, Walgreens, Target, you know, to those pharmacies that they don't deliver. So it might be 4 or 5 days before they get their medicine. So if you had an overlay of the pharmacies and knew that they delivered Monday through Friday, you know, at least you could get your medicine on time. I don't know, just some brains. I always get have more ideas.
Blessings.
I don't know how to execute this, but I could see where you could just kind of put a little panel on, because so many times people have to walk. And if you're, people anymore don't hardly even know how to read a map because they because they well, I will also teach you Persian.
I also put in the chat, I'll be in Kearney and Grand Island tomorrow, Thursday. So if there's organizations that you want me to drop that 211 flyer off at that has that self-referral code, I can do that. So it doesn't have to be hung up like at a provider's place of business that's a Unite Us partner. I can hang it up at grocery stores, Menards, anywhere, so people can like self-refer in if they have needs too. So.
Well, maybe ask our transportation partners, how can a group like this further support you? Do you want to continue to have meetings like this where we brainstorm ideas, or let us know how we can be helpful.
I'm all for more meetings just to kind of see where we stand, because as of now, like I said, we're gonna have to make a bigger investment into what we already have, just because the demand's there. I met with Charles from RIDE, and I know they've sent a lot of business our way, and we're grateful for it. But at the same time, it's overwhelming, just because we didn't realize how many people actually use public transportation. I think we'll be able to overcome it here. But I think it would still be nice to have a little input on, see where we stand there.
This is maybe more of a question that doesn't necessarily need to be answered, but I heard you say that in the beginning, is that the demand's there, but you don't necessarily know how you're going to expand, right?
Right.
So in my mind is, who are our employment partners who have people that are looking for more flexible employment opportunities, but don't know that you're up and running, or how can we start connecting those partners? But I don't know who that is exactly, but I feel like we've heard of people that are looking for some of those employment opportunities, and how do we connect them with you so that way it's natural.
Yeah, that would actually help out a lot, because so the problem that we've been having is, I don't know if you guys are familiar with the Public Service Committee. They are very vigorous in their background checks. We're doing a public service. And there were questions about my background. I had to go explain that. So at this point, I've been about 1,000 times tougher on people than they were on me, just to alleviate the concerns of the community from past actions of past companies. And that's one thing, we're trying to set ourselves apart from any bad juju from anything, and I've had probably 50 applications and I've hired 0. I've made posts stating what we can't hire and what we won't hire. So I don't know. We've had some interesting applicants, to say the least. I'm all for second chances, but in this situation, I'm very limited on what I can or will do. So I like that idea. I absolutely do. I love it. But like I said, we're having a hard time finding good quality candidates that I can actually consider. I get the applications, and the first thing on there, I've got felony this or felony. I'm sorry, I can't do it. And a lot of people think that it's kind of a double standard. I have criminal history. I'm not a felon. I don't have a lot of things that these people that are applying do. Well, like I said, I would love to give them a second chance, but I can't take the chance on them doing something that's going to compromise my business or compromise the safety of the community. So
we do have a group that we have worked with out of Omaha called RISE. I don't know if you've connected with them at all. We love RISE. I'm just going to say I love RISE. I don't know. We've talked with them for over a couple of years now to figure out how to get connected to the people that graduate from their program and already employed. Maybe having some conversations with Jeremy, which we can maybe get you his contact information, or maybe Jeremy's so busy, I'm not sure. Think about how to get you connected with them. So their graduates are coming out of prison, and they have had a lot of training while in prison, and they're coming out. And Jeremy says, take a chance on Olympics. And so they're doing some promising work out there. Okay. But that might be a company for you just to give a shout out to learn what we're doing, see if it's something that they RISE, RISE out of Omaha. They're in every state penitentiary. 4 locations. Sorry, I can't remember how many state penitentiaries we have. And they're doing some phenomenal work. And the Omaha, I would say the Omaha community is really impressed with the work that they're doing.
Okay.
I don't think Kearney is there yet. I don't think they see the promise of that work yet, or what they've been able to do, but I think there's a lot of promise there that we could at least introduce you to Jeremy.
Okay, perfect, yeah.
Yeah, it's a fantastic program. And every time I ask him, what can we do for you in Buffalo County, he says, hire the people to graduate, so I think that would be fun to see. Well, what I'm hearing, and I know there's some other pieces on the agenda we want to get to, what I'm hearing is you want to continue some type of conversation around transportation resources. I don't know that we have to do it monthly. What do you think, Angie and Jamie? I think maybe something quarterly of just coming together and inviting more partners. We could focus on maybe bringing more employers to the next conversation. Mm-hmm. What would Chariot's focus be? Is employers an area of your interest or more churches?
Churches, volunteers. And you've given me some information here, the leadership card, Kathy Gosh.
Okay.
Those are in the three that are on the team. Now I did reach out to Kathy and Ken, and I don't know if they went to spam or not, because I never heard of it from them.
Dr. Schaefer, Ken is in Florida right now. Okay. I don't know if he's back yet. And Kathy is, she's dealing with some health issues right now. So that's why I didn't want to bring her here today. Yeah. So give them a little space and grace. And I think I'll send an email to them too and let them know. Yeah. Do I have your email?
Yes.
Address? Okay. I'll make sure and connect you to via email.
You know, I do have a question. I don't know how many churches actually have vans. Or how many of them have them just sitting in a garage right now because they have no drivers, or they're concerned about the liability, or I've often wondered about that because like even with the Jubilee meals, if there could be somebody, you know, like at least at the churches that are sponsoring the meals, if somehow between those churches they could maybe have a pickup place.
The last meeting was the Meals on Wheels group that said, how can we help support you? Because they're church-based volunteer groups that go over meals.
Right, that's true. Okay, I guess I can speak for First Baptist. We have a van, and I'm no longer a driver because
you're busy.
I'm just, yeah, I got it. It was a summer that I think every kid that went to camp, I took them there. But yeah, we have, the insurance requires us to go through a training. And so you have a certain amount of certified drivers. But if those were volunteers and the church will approve it, it could be used for those kind of things. So that's part of probably what we're going to try to work into this, depending, you know, every church is going to have a different policy on.
And I was going to say one thing that I, over the years, being in the community, that I think a lot of people are not aware of is the migrant education program. And that's a whole other set of families that I think churches could embrace in some way, you know, at least to get them meals or it's hard or
Is Chariot taking girls? Are you taking your girls in public community this year? Because we have a case where.
Yeah, no, we're in the development stage.
That's good to know because your name came up just yesterday, I think, on one case we were working for right? Yeah. That's good to know.
Abby was going to share and we're at time. So what are your thoughts on that? It was that north. I'll just let you share. Yeah.
Yeah. I can't read that part. Sorry.
Can you read it, Matt? Or
yeah. Abby said, still an issue of wheelchair accessible options outside of normal business hours. And then there is out of North Fork's option reopening in April called Night Lift, possibly bringing in the NDOT and look at expanding federal funding to support and expand services we've already have. So plug it in their website in there. Do you have anything else, Abby, that you wanted to share?
I do, but I can't stay on any longer. So sorry. I just I mean, I'm still in contact off and on with the NDOT, and I think we might be potentially missing out on a partner that could look at some options for maybe a model of how to expand on the services that we have. Again, you have to have the staffing and the funding, but I think what I'm also hearing is that we maybe are at like maintenance phase here, but we don't really have a sustainable plan always for our county. So I guess I feel very strongly that there are probably some funding opportunities out there between the NDOT or it sounds like this option with and this is out of Norfolk, Nebraska, but they call it North Fork because people can't ever say their name right anyway. So, but like they talk about how they get funding through some of it's through a federal agency. So, and I actually checked, and even though we were under the impression that they took a hiatus because of funding, which I do think is true, it sounds like their business was not being managed in integrity wise, and so they actually stopped the program to do some investigations. And but they share that their transit options are eligible for cost reimbursement from the Federal Transit Administration and NDOT, so they can get their operating expenses reimbursed at 75% and some non-operating expenses at 90%. So I don't claim to know this business at all, but I just wonder if we could be expanding. I just worry that I know this is more about what services do we have in place, but there is still a very vulnerable population that is, there just is absolutely no available resources. And I just feel ethically like we have to look at that. So.
Thank you, Abby. I really appreciate that. I'm sorry you ran out of time. I know you were kind of working on the Norfolk piece and watching that, how all that's unfolded. And they do have, I think they have somebody that's purchased a couple of vans off Facebook, and they're just trying to get people throughout the community transported right now, since they're a little bit in crisis, but it's definitely a good model to look at. I guess maybe even like our elected officials might be something too that we might want to talk with our unicameral or our representatives or state senators, see if what other funding's out there that we maybe want to look at. That's a possibility. I don't know right now if anybody's actually looking at transportation federal funds. That might be more of a Charles question, because he seems to really be on top of that type of funding. But outside of Charles, I'm not sure if anybody else in the community is really watching the federal transportation dollars or state transportation dollars. Well, I'm sorry we ran you all over time. What I'm hearing is that you're interested in continued conversations. You're interested in just brainstorming ideas and solutions. We have interest in bringing more conversations around churches. We're interested in more conversations with employers if possible, possibly some elected officials. And did I cover everything we needed to cover? One, I'm going to hand it back to you.
Yeah, I think you covered everything from my perspective.
Or maybe Angie, I'm sorry.
Yeah, so thank you guys all for coming. And so for the sake of those of you that are here for transportation only that need to leave, or we're done with that piece, so we're going to transition into some other business. And we'll